Hello, everybody. You are listening to The Vegas Voice, the voice for your health, wealth, and good times. I'm Dan Roberts, the publisher and editor of The Vegas Voice, and I will be your host for the next 30 minutes. My guest today is another great example of why we are so proud of The Vegas Voice. This week, we will highlight our goal of being the voice for your health, wealth, and good times for our monthly grown-up newspaper. In particular, we will discuss the good health aspects for our readers. I will be joined and have the pleasure of an exclusive and extended interview with Dr. Jonathan Sorrell. Dr. Sorrell operates the Minimally Invasive Hand Institute. Anyone who suffers, for example, carpal tunnel syndrome will want to hear what the doctor has to say. And if I can add a good word and recommendation, one of our columnists at the Vegas Voice, our Sue Ann Bamer, who writes our Senior Sense columnist, raves and highly recommends Dr. Sorrell. I have to tell you, if the good doctor meets our Sue Ann's approval, Dr. Sorrell should be the man for all your upper extremity medical problems. But before we begin our interview with Dr. Sorrell, I would like to begin the program by quickly mentioning the real reason we're heard on KLAV, the Vegas Voice newspaper. For those of you unfamiliar with the Vegas Voice, we are the largest senior monthly publication in town. We are distributed everywhere from North Las Vegas to Boulder City, and we are the only newspaper that mails our paper to all high-end age-qualified communities. So with that in mind, we're going to take a break, and when we get back, we're going to speak with Dr. Sorrell, and you are listening to the Vegas Voice, the voice for your health, wealth, and good times.
Now that spring is here and summer's coming, don't let your hand or arm pain and numbness limit your lifestyle and fun. Dr. Jonathan Sorrell's Minimally Invasive Hand Institute can help get to the source of your pain and discomfort. If surgery is needed for carpal tunnel release, Dr. Sorrell's Minimally Invasive Advanced Technique leave you with no downtime, with only one very small incision and no sutures. Most patients are using their hand the very next day and are down to a Band-Aid and have no restrictions after a week. And unlike those guys who advertise on TV and billboards, we accept most insurances. Dr. Sorrell's Minimally Invasive Hand Institute. Call 739-4263. That's 739-4263. The Minimally Invasive Hand Institute. Exclusively dedicated to the care of the upper extremity.
And we are back. You are listening to the Vegas Voice, the voice for your health, wealth, and good times. And as promised, I am here with Dr. Jonathan Sorrell from the Minimally Invasive Hand Institute. Dr. Sorrell, thank you so much for being here.
No problem. Thank you guys for having me.
Well, let's start out right from the beginning. Tell us a little bit about the Institute.
You know, I started it approximately a year ago. I went off on my own to start my own business. I originally had started with the Brown Hand Center and left and went out and decided to do my own thing.
Tell us a little bit about the Institute. What type of doctor are you? What do you do? What do you perform? How do you help the individuals?
Okay, so basically a hand surgeon is somebody who's gone on and gotten specialized training in hand surgery. So that means you've completed a full 5-year residency in general surgery and then a additional training for a year in hand surgery.
Well, when I think of hand surgery and problems, one of the things that has come up now is carpal tunnel syndrome. I don't know what that means, but again, I read about it all the time. Everybody has it, but no one can explain it to me. Tell us a little bit about it.
Okay, what it is it's basically a tunnel. On one side is walled by bones, and the other side is just ligamentous. And ligaments are like chains. They go out to a certain length. They have no more give. There's no stretch to that. So what ends up happening, if there's any cause for swelling or hormonal changes or changes in your health, such as diabetes, thyroid disease, gout, rheumatoid arthritis, even pregnancy can cause carpal tunnel syndrome. And what happens is that tunnel just gets really swollen and it compresses the nerve that goes through that tunnel, and it can cause it to actually die.
Dr. Sorrell, one of the things, again, in my very limited medical career, which is none, is the fact that we never heard of that term until after computers came into use, because everyone who's on the computer seems to come down with it. Is that unusual? Or?
That computers actually have gotten a real bad rap about that. The computers actually have been shown in typing greater than 6 to 8 hours a day, and our largest retrospective randomized trial has actually shown that, and this was again with 25,000 people, has shown that actually typing is protective against carpal tunnel. That research, quote unquote research, that was done back in the 60s was actually just an assertion. They never even looked at typing. So we found that it's kind of like bringing a wet rag through a hole in a steel wall, is the way I explain it to my patients. When you pull that wet rag through that steel wall, it expresses some of the water on one side. Then the next time you pull that wet rag through, it's a little bit easier to go through the hole in the wall. It's the same thing with carpal tunnel. When you're typing, your tendons are actuating back and forth, and it kind of expresses some of that swelling and water out on either side of the carpal tunnel.
That's a nice way of explaining it, to say the least. Most of the people that come to you, are they of a certain age group? I mean, does it affect everybody, or some people, women, men? How does it affect?
You know, it's, I think, 3 to 1 more common in women, and I found that to be true in my practice, not just in the textbook. It generally tends to affect the older people, but it can affect anybody. I've had to do carpal tunnel surgery on children as young as 8 years old that have had trauma to their hand or wrist, have broken their distal radius, and anything can cause swelling in that area and can cause the need for decompression of that area. In fact, it's probably one of the most ignored problems that you can see in emergency rooms that gets forgotten about.
And is it because the other doctors in the ER are not trained, or they don't know what to look for, or they just don't know what it is?
You know, it's a compartment, and a lot of times they get taught to look for muscular compartment syndrome, but they don't really think about the nerves and the carpal tunnel as a compartment, and it really is. And I've seen some of the most horrendous injuries have been just from ignored carpal tunnel syndrome that has been missed.
And again, for those just tuning in, we are chatting with Dr. Jonathan Sorrell from the Minimally Invasive Hand Institute. Doctor, tell us about the options for carpal tunnel syndrome.
You know, you can always start out conservative, and some of the conservative treatments for carpal tunnel include oral or injected steroids, oral NSAIDs, which are non-steroidal anti-inflammatories. They're a little less strong than the steroids, but they can help. You can also try nighttime splinting. Daytime splinting does not help at all. Nighttime splinting may help alleviate some of the symptoms. What we found, and this is in prospective randomized control studies, at 5 years, 98% of the people still have carpal tunnel. So unless this is an acute situation that you expect to resolve, something like an acute trauma that's the numbness and tingling is resolving quickly, it's probably a more chronic issue that's going to need surgical intervention.
And you know what? One of the things, Doc, I should have asked you this before, is that I assume people have carpal tunnel syndrome without even realizing it. What would be the signs that, listen, I have a problem?
Absolutely. So many people come in, and it's unfortunate that I see them too late. The best results that we get is when the patient comes in early, as opposed to late for treatment. And some of the signs and symptoms you get are numbness and tingling in the hand, but it's not always numbness and tingling. The real tricky ones are sometimes it's just wrist pain. Sometimes you have pain in the shoulder. Sometimes you have pain in the neck. And the bottom line is a lot of times this gets misdiagnosed, and you really need an electromyogram, an EMG test to help you diagnose this. And a lot of times neurosurgeons or family practice doctors just don't get it because they think it's arthritis or it gets misdiagnosed.
And you know, Doc, I mean, one of the things that I find, I guess, somewhat confusing is that if I have a pain, like you said, in the neck or in the shoulder, I wouldn't think of being related to my hand or my fingers.
Absolutely. And I see it all the time. I see people that have come in that have had shoulder scopes or have had their neck fused and really have no relief, and they're wondering why, and they haven't had a nerve test.
And I guess the general practitioner are they trained to think that, or they look at something else? You know, it's really kind of an advanced training that you need to differentiate the difference between run-of-the-mill arthritis and a carpal tunnel-like symptom. It's kind of difficult, and they really should be seen by a specialist. I mean, this isn't something that should be tinkered with by people who haven't specialized in hand surgery. And you know, and if it's not carpal tunnel syndrome, could it be another ailment that might coexist or coincide with it? Absolutely. There's what's called trigger fingers, and it's a very trigger fingers. It's not what you think. It doesn't have anything to do with shooting a gun. It's just a tendinitis that actually occurs concomitantly at the same time with carpal tunnel symptoms. And that's generally palmar pain or a clicking that you can notice in your finger, and that's where it got its name from, trigger finger, because your finger kind of triggers back and forth as the tendinitis is passing underneath one of the pulleys in the hand. And you know, you mentioned it earlier. How can you tell whether it's carpal tunnel or I have arthritis, I'll take a couple of Advil or something and it should go away?
Anytime you have to take medicine chronically, I think the average layperson should know and be astute enough to say that maybe this is something I need to look into a little bit further. Rather than taking medicines every day, I think that that's something that needs to be looked at into a little bit further.
And is there like a rule of thumb, like you give it a week with the let's say you have arthritis, so you don't even know what you have, you assume it's arthritis.
Right.
I mean, for a lay person who is not familiar with the medical terms, especially the medical conditions,
Right.
Dr. Sorrell, what do they do? Like if you still feel pain after a day, 2 days, at what point do you say, wait a minute, this might be more serious than just run-of-the-mill sluggishness or getting older?
I'd say anything beyond a couple weeks of taking over-the-counter anti-inflammatories is something that should be looked at and had an X-ray taken of and looked into further, because oftentimes people try to self-diagnose and frequently they're wrong. And
I would assume that, yeah, to say the least. And doctor, just out of curiosity, if you have it in one hand, are the odds good it's going to be in the other, or is it just like a one-shot deal?
Absolutely. The majority of people have at least some degree in both hands. Usually one hand is worse. It's not always the dominant hand, funny enough, but it almost always is present in both hands.
And again, you may have repeated, but at least let's go into it again.
Yeah.
What would cause it? I mean, if like take myself. I mean, I feel occasional pain in my hand. Is it I'm getting old? Maybe arthritis? How do I know whether it's carpal tunnel? How would I even think about it?
Three of the biggest symptoms that you get in carpal tunnel are the nighttime symptoms. So it kind of wakes you up at night, or for the people that take a lot of pain pills or that take sleeping pills to help them sleep through the night, in the morning when they do wake up, their hand is generally very stiff. It takes them a half an hour or so to get their hand moving. And also anything that what I call the dependent symptoms. So anytime their hands up on a steering wheel, for females when they're applying makeup or doing their hair, reading a newspaper or a Kindle or whatever anybody reads nowadays.
Yeah, sure. I mean, and it's something where, again, it's not like a one-shot deal. You feel some pain, you can't move your hand, and the next day you're fine. I mean, this is a continuous problem.
This is a chronic thing that you would notice more than just a single time.
Okay, and what we're going to do, doctor, is we're going to take a break. Stick with us.
Okay.
But you know what? As we go to the break, tell us again, if somebody wants to reach you at your institute, how do they go about doing it?
The best way to do it is just to give us a call. It's 702-739-HAND, HAND, which for people with the Blackberries and don't have the letters, it's 4263. So 702-739-4263.
And if they want very quickly information on the website?
The website is TMIHI, the Minimally Invasive Hand Institute. So it's TMIHI.com.
All right, so we're going to take a break. Stick with us, doctor. You are listening to the Vegas Voice, the voice for your health, wealth, and good times.
Now that spring is here and summer's coming, don't let your hand or arm pain and numbness limit your lifestyle and fun. Dr. Jonathan Sorrell's Minimally Invasive Hand Institute can help get to the source of your pain and discomfort. If surgery is needed for carpal tunnel release, Dr. Sorrell's Minimally Invasive Advanced Technique leave you with no downtime, with only one very small incision and no sutures. Most patients are using their hand the very next day and are down to a Band-Aid and have no restrictions after a week. And unlike those guys who advertise on TV and billboards, we accept most insurances. Dr. Sorrell's Minimally Invasive Hand Institute. Call 739-4263. That's 739-4263. The Minimally Invasive Hand Institute. Exclusively dedicated to the care of the upper extremity.
And we are back. You are listening to the Vegas Voice, the voice for your health, wealth, and good times. I'm your host, Dan Roberts. And as I mentioned before, I am joined by Dr. Jonathan Sorrell from the Minimally Invasive Hand Institute. Dr. Sorrell, thank you for sticking around.
Happy to do it.
You know what? Let's go right into it. You mentioned carpal tunnel syndrome. What happens if you don't address it? Again, a lot of people might think it's arthritis or I'm getting old, and they ignore it. I mean, that's a very serious type of, illness.
Absolutely. And the message I'm trying to get out to family practice doctors, to the medical community, to patients to everybody, is that the sooner we get to address the nerve compression, the better the results are. If you have chest pain, you don't sit at home and wonder if you should go into the emergency room because you're worried it's a heart attack. And everybody knows that the quicker you get into the emergency room when you have chest pain, the better results you have. Same thing is true. This is an ischemic event. It's not enough blood flow going to the nerve. It's just like there's not enough blood flow going to the heart in a heart attack. So it's a very similar process that happens. Of course, it takes a little bit longer. It's not as quick as a heart attack. It usually occurs over the course of months to years, but still, in as little as 8 weeks, we can see a clear progression of nerve damage if we repeat that nerve test that I was telling you about before.
And you know what? On a serious level, again, you mentioned if you have chest pains, you don't go to the ER. I mean, you literally can die. You can have a heart attack and die.
Absolutely.
If you ignore carpal tunnel syndrome, what's the worst case scenario? Does your hand fall? I mean, hand fall. I'm not trying to make light of it, but do you lose the use of your hand? What happens?
One of the saddest things I see is that the typical patient is in their 80s or 90s, and they have what I call a cooked nerve. It's had such bad and prolonged nerve compression that really there's no sensation left in it. They actually start burning their hand on the stove.
Really?
They don't feel it, they smell it. They can actually progress so that they can't even dress themselves. They can't feel the buttons, they can't feel the zippers, and they need home health. And the sad thing is that as we all are living longer, we really need to address the quality of life issues. And so I see a lot of older patients coming in with home health nurses or aides that they rely on because they can't use their hands, and they have fully functioning brains and their bodies are still in good shape.
Oh, okay. And then let's go to Dr. Sorrell. Again, as I mentioned to you, one of our columnists, Sue Ann Bamer, does the Senior Sense column. She had problems. You took care of it, and she raves about you. I mean, she really cannot say enough good things about you. What do you do, or what kind of specialty do you have based on your training and experience that you can help people with carpal tunnel syndrome?
Well, one of the things I bring to the table, I think that's a little bit different than most of the other people here in the Valley, is that I do minimally invasive surgery, not just for carpal tunnel, but also for cubital tunnel, which is another area of nerve compression. I can do wrist arthroscopy, I do CMC joint arthritis procedures, and all through a very small scope that's about the same size as a pen.
And, you use those medical terms, which sounds great. I'm very impressed with it. But to a layperson, they have no idea what that means in very simple terms. What do you have and what can you do when you say minimally invasive? I really don't know exactly what that means.
So if the listeners could just picture the size of the hole in the tip of their pen, that's about the size of the camera I use. And I can go into different spots in the hand and wrist and arm and relieve compression, take care of arthritis, take care of different ailments that exist that typically required a big, old-fashioned 4 to 5 centimeter incision, longer recovery time, and physical therapy. Less than 1% of the people I operate on need any kind of physical therapy.
I mean, I would assume, and I'm just going with what Sue Ann told me, to be honest with you, Dr. Sorrell, is that the recovery was great. There was really no pain. Talk a little bit about that.
After a typical carpal tunnel release or even a cubital tunnel release, most patients require only a little bit of Tylenol or a little bit of ibuprofen for pain control. I put in long-acting numbing medicine, so most of the patients are comfortable with local anesthesia that I give them for 8 hours up to even a week. So with just a little bit of Tylenol and ibuprofen, they're not taking the Vicodins and the Percocets and the stronger narcotics because they don't need it. I make such small incisions.
And again, you mentioned, and I'm fascinated by this, even though I don't understand the medical technique. You say you have a camera that is that tiny that you can just go in and just look at it. Talk a little bit about that. Again, I find that fascinating.
Right. The camera I use is, depending on the surgery, somewhere between 2.7 to 4 millimeters in size. And I can actually put the camera, position it into the carpal tunnel inside, and I can actually bring a blade back and cut that ligament that's putting pressure on that nerve while protecting the nerve underneath a cannula, which is just a pipe for all intents and purposes that pushes the nerve out of the way. And the technique I use is actually currently the smallest in the world. A lot of times people see TV ads for small and minimally invasive endoscopic carpal tunnel releases, but the technique I use is actually the smallest.
I mean, I just find that incredible. The training you must have and the experience has to be phenomenal.
Well, I appreciate that, and I do think that it definitely takes some training and some actually experience doing these.
I would think so. I mean, if you let me loose with that little camera and a blade, I mean, it'll just be a mess.
Yeah. No, even trained hand surgeons, when they're older and they haven't been trained in the newer techniques, the learning curve is probably between 25 and 50 cases before you can really get the hang of it and know what you're doing.
I mean, that's truly incredible that you can do something like that. Once you do that, if everything is a normal, if that makes sense, carpal tunnel syndrome, once you do that surgery or that procedure, let's use that word, what happens then? I mean, are they fine the next day? Are they fine in a week? Do they need physical therapy? I mean, it's just incredible.
One of the reasons that I actually helped develop this is that the incision that I use is not even on the hand; it's on the wrist. So people go down to a Band-Aid at day 2.
Really, just a Band-Aid.
Just a Band-Aid.
That's
So for
really
the
incredible.
dealers and the people that work at casinos, they can't have any bandage on their hand. And so they were coming to me and they said, "Doc, I need surgery. I need to go back to work. What can I do?" And so and there we have it. I had to keep the incision off the palm, and they had to go down to a Band-Aid because they couldn't have a dressing. So I had to make holes a little bit smaller.
And just out of curiosity, Dr. Sorrell, when you do this, is the patient under anesthesia? Is it local? Are they awake? Or
We can do all different techniques. I've done it under just straight local, which is just the numbing medicine in the arm. We've done it with IV sedation and regional anesthesia, which is where the whole arm gets numbed up. And then we can put you to sleep, and that's typically the easiest for patients and the one that most patients choose. You're only asleep for actually only 4 minutes. It's so quick that I can do these in about 4 to 5 minutes now.
literally, from the time you start and you put them under, it's like a 5-minute procedure?
The full time that they're under is only about 4 to 5 minutes. Yeah, the procedure actually takes me about a minute and a half to do.
Really?
Right. And the rest of it is dressing the hand and injecting the local anesthesia and taking care of everything else.
And is that because, again, I find that very fascinating. Is it because of the fact that obviously your skill and your professionalism, but is it because of the fact that the camera's right there and it's just a quick 1, 2, 3 type of procedure?
I've done several thousand of these, and at this point, I have the procedure honed down, and my team is honed down to the minimal amount of movement, the minimal amount of strokes that we need to do the surgery. And it's just like golf. If you hit 10 times, it's going to take you longer to get through 18 holes.
Right.
If you hit it 4 times and you can make par, you get through the game.
I mean, again, that's really incredible. Let me ask you this, doctor. If people need this type of procedure, are they covered by insurance? Or is it something that they have to pay cash for? I mean, that's something that I guess is very important because most people really, in this economy, money's a factor.
Absolutely. I take all major insurances. The only one that we're currently not on is the HMO from Sierra, but other than that, we take every insurance, including TRICARE, Medicare, Medicaid.
So it's
really
covered
everything.
by insurance.
Absolutely.
So really, if you have this type of pain, I mean, you can correct it, and I guess in a week or 2 weeks, the pain is gone, or what's the procedure?
Actually, the first night after the procedure, they don't wake up anymore.
Really?
And that's how I tell them. That's how they know they've had a good carpal tunnel release, is because that first night, that numbness, the tingling, the major symptom that brings them into my office is gone.
I mean, that's really incredible.
Yeah.
In the minute or so we have left, Doctor, if they want more information, how do they get a hold of you? How do they get a hold of the Institute? Give us the numbers and everything else.
The best way is by phone, and that's 702-739-4263, which spells hand, and the website is TMIHI. That's the Minimally Invasive Hand Institute, TMIHI.com.
And again, if anybody wants more information, they can contact the Vegas Voice at 251-4441, and we'll be happy to spread the word about Dr. Sorrell and his institute. Doctor, again, I thank you so much for being here.
It was my pleasure.
And I just find it to be just a fascinating subject. That's something that can be so painful. In the course of about 5 or 10 minutes, it's gone.
Yeah, and it's gone for good. The recurrence rate is less than 1 in 100 to 1 in 1,000. And actually, on my patients, I've never had to repeat one.
Oh, I think that's great. Yeah. Dr. Sorrell, tell me the phone number again, please.
702-739-4263.
Dr. Sorrell, thank you so much for being here.
Happy to do it.
We're going to take a break, and we'll be right back. You're listening to the Vegas Voice.
Now that spring is here and summer's coming, don't let your hand or arm pain and numbness. Limit your lifestyle and fun. Dr. Jonathan Sorrell's Minimally Invasive Hand Institute can help get to the source of your pain and discomfort. If surgery is needed for carpal tunnel release, Dr. Sorrell's minimally invasive advanced technique leave you with no downtime, with only one very small incision and no sutures. Most patients are using their hand the very next day and are down to a Band-Aid and have no restrictions after a week. Dr. Sorrell's Minimally Invasive Hand Institute, and unlike those guys who advertise on TV and billboards, we accept most insurances. Dr. Sorrell's Minimally Invasive Hand Institute. Call 739-4263. That's 739-4263. The Minimally Invasive Hand Institute, exclusively dedicated to the care of the upper extremity.
And you are listening to the Vegas Voice, the voice for your health, wealth, and good times. And I want to thank Dr. Sorrell because the information he provided was just incredible. And anyone who has carpal tunnel syndrome should be running over to Dr. Sorrell, get the information, and hey, it can change your life. You never know. So with that in mind, we want to thank everyone for tuning in and listening to the Vegas Voice. Special thanks go to the wonderful people at KLAV for letting us into the studio, and especially to our man, John. Once again, John, thank you so much. A very special thank you to our guest, Dr. Jonathan Sorrell from the Minimally Invasive Hand Institute. By the way, if you have any questions about our publication or just want more information about the Vegas Voice, the voice for your health, wealth, and